Hi, good afternoon. I'm Jessica Robinson, and today we're going to discuss the national opioid crisis. And today is June the 25th, 2019. Our objectives for today are, by the end of my presentation, you will know what an opioid is. You'll be able to identify what the national opioid crisis is, and you'll be able to recognize signs of drug abuse. You'll also be able to explain the impact of the national opioid crisis. Can anyone tell me what are opioids? What are opioids? Anyone? Okay. Opioids are a class of drugs naturally found in the opium poppy plant, the poppy seed. And they have the poppy seed dressing, salad dressing. It's pretty good. They are often used as medicines because they contain chemicals that relax the body and can relieve pain. Prescription opioids are mostly used to treat moderate to severe pain, though some of them are used to treat coughing and diarrhea. We have the Phenergan cough syrup, or the hydrocodone cough syrup with the Phenergan in it. Opioids also can make people feel very relaxed or high, which is why they are sometimes used for non-medical reasons. This can be dangerous because opiates can be highly addictive, and overdoses and death are common. Opioids are a class of drugs that include the illegal drug heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription such as oxycodone, hydrocodone, codeine, morphine, and many others. More commonly now we see hydrocodone. How do people misuse prescription opioids? Opioids used for pain relief are generally safe when taken for a short period of time as prescribed by a doctor, but they can be misused. People misuse prescription opioids by taking the medication in a way or dose other than what's prescribed, or taking someone else's prescription medication. We know that some people that sell their opioids, that sell their pain meds, or taking the medicine for the effect that it causes just to get high, and that's what we see a lot of people buying them just to get high. Some signs and symptoms are drug cravings, anxiety and irritability. These signs and symptoms of addiction. A lot of them, when they can't get the pain meds, they do become irritable. You have them, I've seen in the hospital, they come in and they ask for certain pain meds, and when they can't get, they get highly agitated. Insomnia. Some of them can't sleep when they can't get it. Abdominal pain. And vomiting. They also have diarrhea. And the tremors and shaking that are kind of like withdrawal symptoms when they can't get it. They also feel cold. Signs of overdose include slow, shallow breathing, extreme sleepiness, inability to talk, blue skin color, and dark colored lips. They start experiencing cyanosis. Snoring or gurgling sounds. Those are all the signs of overdose. How do prescription opioids affect the brain? Opioids bind to and activate opioid receptors on cells located in many areas of the brain, spinal cord, and other organs in the body, especially those involved in feelings of pain and pleasure. So it affects your nervous system. When opioids attach to these receptors, they block pain signals sent from the brain to the body and release large amounts of dopamine throughout the body. This release can strongly reinforce the act of taking the drug, making the user want to repeat the experience. That's why it's highly addictive. The effects of opioids on the brain and body include harmful effects such as drowsiness, confusion, nausea, constipation, euphoria. Those are, the false high feelings, the good feeling. And slow breathing, slow respiration. Other health effects of opioids include older adults that are higher risk of accidental misuse or abuse because they typically have multiple prescriptions and chronic diseases, increasing the risk of drug-to-drug and drug disease interactions, as well as a slow metabolism that affects the breakdown of drugs. That's why we have to do the liver functions test, because it does affect the livers and the kidneys. Sharing drug injection equipment and having impaired judgment from drug use can increase the risk of contracting infectious diseases such as HIV and from unprotected sex. You see that hepatitis C included with the HIV. National Opioid Crisis Statistics. The misuse of an addiction to opioids, including prescription pain relievers, heroin, and synthetic opioids such as fentanyl, we see that in the patch a lot, is a serious national crisis that affects public health as well as the social and economic welfare. You have roughly 21 to 29% of patients that are prescribed opioids for chronic pain, they misuse them. They get used to it. A lot of them just keep going back asking for pain meds. And now the federal regulations have tried to get a grip on it, where doctors can't prescribe the opioids like they used to. They're under close scrutiny. They have an estimated 46% who misuse prescription opioids transition to heroin. Opioid overdoses in large cities have increased by 54% in 16 states. That's a large number. Between 8 and 12% develop an opioid use disorder, have a dependency disorder. The treatment of pain in the U.S. is non-satisfactory, and the overall over-reliance on opioids has contributed to widespread consequences. Patients experience ongoing barriers to adequate pain management, so as a result of this, treatments have focused on prescription drugs because of the healthcare system. The FDA, as I mentioned, have trying a few things to try to contribute to controlling the opioid crisis. The aim of the FDA is to provide patients in pain access to effective relief, and to reduce the misuse and abuse of prescription opioids through preventing prescription drug abuse, which, like I said, they crack down on providers giving out opioid prescriptions. The Lortab, Norco. Treating opioid addiction and saving lives from opioid overdose. Some of the impacts of the national opioid crisis has a tremendous negative effect on parents and children by destroying lives and breaking up families. I said they become addicted. We have billions of dollars that are spent on medical care for those that are addicted to opioids. The epidemic results in higher insurance costs to cover the impact on medical resources. And the impact of this epidemic on the medical community is drastic. So hospitalists come up with multifaceted approaches to reduce the misuse of opioids. Like I said, go in the ER and say you got a toothache and you ask for some pain meds and they see you're a regular, you go in every week. They're not gonna give it to you. Or you going, you broke your toe 2 years ago and you say you still having pain, then they're not gonna give it to you. They're just not gonna give it to you because it gets them in trouble. So, questions, how can I make a difference? I can make a difference by becoming educated and familiar with the national opioid crisis. With the epidemic becoming larger day by day, I feel that I can become more adept in executing versatile approaches to meet the needs of patients and their families. How is my organization combating the epidemic? There are numerous ways in which my organization combats this epidemic. For example, before prescribing opioids, we screen for high-risk conditions, develop and follow pain management protocols, discuss other treatment options, and also evaluate the reasons for current use of prescribed narcotics. So like I said, you can't just walk in now and just ask, you can name what you want. They're going to find an alternative treatment. It's not going to be the first thing they give you.
Mm-hmm.
And this concludes my presentation on the national opioid crisis. My references are listed: the Cicero, TJ, and Ellis, the prescription opioid epidemic, a review of qualitative studies on the progression from initial use to abuse. And the website is provided. If you need any additional information, you can contact me and I can share that information with you. Thank you for your time, young ladies. Any questions?
You did good.
Comments?
Okay. Everything was decent.
So now we see why, we see the patients that ask for pain meds, and we just can't go with the doctor's not gonna go with that because they have the federal regulations changed because they knocked the dose down from the lower tab to the Norco. That was the first thing I noticed some years ago, but now they gonna try something else first because it is. Now people been selling pills for a long time. They go get the medicine, don't need it, just to sell it. And you got those that just go get it just because they are addicted to it. So they tighten up on the providers. Quite a few of them got in trouble for just writing the prescriptions. Nurse practitioners, just, I don't know, for a friend or, not abiding by the regulations. So it's not to be taken lightly. And it is, drug abuse is a problem, especially in our smaller communities. So, thank you again for your time.